A deadly batch of heroin has hit the Anchorage area. The drug appears to be laced with fentanyl, a synthetic opioid. 3 people who died of overdoses recently had fentanyl in their systems. It's also suspected in the deaths of at least 8 others. Now, here to tell us what fentanyl is and why it is so dangerous is the state's chief medical officer, Dr. Butler. So thank you so much for being here.
Thank you.
So first off, what is fentanyl?
Well, fentanyl is an opioid. It's a synthetic, which means it's made in the lab instead of being derived directly from opium. It's very powerful. It is more powerful than morphine or heroin, and the effects are more pronounced, and also the respiratory depression that can occur is more powerful. So there's a greater risk of overdose. It also acts very, very quickly. So if someone has injected themselves with fentanyl, they may lose consciousness almost immediately and can stop breathing. The other thing about fentanyl that makes it very dangerous is that oftentimes people don't realize they're using fentanyl. It is more often than not mixed with heroin. It's also sometimes pressed into pills, and they're counterfeit oxycodones that have been recovered in Alaska that have been found to have drugs like fentanyl in them, which are much more concentrated than either heroin or oxycodone.
So someone who uses heroin could take their normal dose of the drug thinking that it was what they usually did, but if it had fentanyl, it would have that much greater reaction then in their bodies. That's what you're saying? It's so dangerous that way?
That's exactly the problem. Is regular heroin users, particularly if they have a regular dealer, sort of learn how to dose fairly well, but when you start adding fentanyl in, you've changed the equation altogether, and unexpected things can happen.
Is there any way to tell if heroin contains fentanyl?
Heroin with fentanyl in it does not look any different, and it really would require some type of lab testing to be able to determine whether or not fentanyl is there. So there's no way to purchase heroin on the street and know whether or not fentanyl is in it.
Those 3 confirmed fentanyl deaths happened in just the last 3 weeks, but it's not new to the state. So why are the deaths spiking now?
Yeah, we've had fentanyl show up in Alaska for a number of years now. And I think what we're seeing is not unlike what's been seen in the lower 48, is every now and then a batch will come into an area that has high concentration of fentanyl, and we see clusters of overdoses. About a week ago, we became aware that there were more EMS runs because of overdose. We were in touch with the emergency departments, and they confirmed they were seeing more cases. They were giving more Narcan. And then earlier this week, we documented that there have been an increase in the number of deaths. Yesterday, we got results back on the first 3 of those and found that all 3 of them had fentanyl on board, as well as varying amounts of heroin. So certainly suggests that there's heroin out there that has fentanyl mixed in it.
We understand life-saving drugs like Narcan don't work as well if someone overdoses. So what do people need to know if they have a relative or a friend who is a heroin user?
Yeah, and that's, I like the way you said that, because sometimes people say, well, Narcan doesn't work. Well, Narcan doesn't work as well. It takes more Narcan because fentanyl is such a powerful opioid. So if you're administering Narcan or naloxone, it may take multiple doses. If this is a friend or a loved one, of course, call 911 immediately. That should be done anytime you suspect an overdose. Also, it's very important to learn how to administer CPR, because if the drug isn't going to work, the only thing that's going to save a life is being able to maintain cardiorespiratory function through CPR.
Very frightening situation. Dr. Butler, thank you so much for being with us to break it down today. Appreciate it.
You're welcome.